All right, here we go. Admitting everyone. Fantastic. Wowzers, wowzers, wowzers. Good morning, everyone, and happy Wednesday. Welcome to yet another one of these delightful Wednesday calls. The Exxon webinars are back in business. Thrilled, delighted, vaguely overwhelmed to have this many of you on the call this morning. So thank you all for being here and giving up some time. Could you all drop a 1 in the chat so that I know that we've got no sound issues and everyone can hear me just fine? Hey, tell you what, Ray was ready. We've got a lively bunch today. Barry, thank you very much. Delightful. Okay. Just whilst I'm on it, anyone watch the football last night? 2 in the chat if you did. Anyone at all? Come on, guys, you must have done. There must be some football fans on the call. Okay, so it's just me with shredded nerves today then. That's fine. Good. Well, we're going to try and get through this one with no added time. See what I did there? Here all week. Oh, God, I'm wasted here. Wasted. Right. So is this just me, or does it feel like this one has been a very long time coming? We've been talking about this for what feels like an age, but actually, believe it or not, it's only 2 months ago that Exxon Health announced a strategic partnership with Tortus AI to deliver Surgery Intellect, a sophisticated clinical AI assistant available to all GP practices across the country, regardless of your telephony provider. Last month, we used our time wisely to talk in depth about the compliance, all the compliance issues and the very sensible approach to introducing AVT into a clinical setting. In essence, we will go as fast as we can, as slow as we need. Thank you, Abigail. This is one on the call. Miserable lot. It's the Tortus mantra. It's one that we're all living by, and I think it was a very valuable webinar. So if you missed it, don't worry, I will follow up and send the link in the chat or the follow-up email. But this month, we are here to talk product. Can I get a cheer from the crowd? Literally no sports fans here whatsoever. All right. With that, though, thanks, Patrick. My icebreaker for today, it's a good one. What are you most excited about with the adoption of AVT into practice? Last month we talked, what are you fearful of? This month, what are you excited about? Is it getting time back? Is it having that better connection with your patients? Massive eye roll from the back there, I saw that one. Is it perhaps that you can see the future and you've got some different use cases in mind? We'd love to hear it. Pop it in the chat if you've got any ideas. Freeing up headspace and better discussions with patients. I think that is a good one. Any more for any more? Please feel free to pipe up. I've got a lot going on here. There's plenty of people joining the call. Keep those coming whilst I go through my housekeeping. We've got a big call ahead of us, so I want to get started as soon as possible. We've got some superstars on the call, or at least we were going to have some superstars on the call. We've actually just ended up with this bunch. So apologies for that. So firstly, to let you know, this call is going to be recorded for prosperity and sharing. I'm hoping to share the recording with you shortly afterwards. So if you need to drop off, we know you're busy people. Don't worry about it. You're not going to miss a thing. Other thing to tell you, we love the questions, of course. So pop them in the chat as we go. We'd love to hear what you've got to say and make sure they are deeply probing, because we have some very good people on the call to answer those questions. To introduce them, it's me, it's Lucy Glynn, Head of Community at Exxon Health. With me today, we were going to have Dr. Dave Trisker, but he is somewhere in the ether trying to find internet. So actually we have a stand-in with us today, which is the delightful Mel Latto, Product Director here at Exxon Health. We've also got the rather impressive Patrick Denston, Practice Manager at Alexander House Surgery, and Hafsa Amidi, who is, remind me, I have got it written down and I've totally lost my paper.
At Tortus AI.
She's a superstar, thank you. Just right there on the mark. Right, so we're going to have to change things up ever so slightly whilst I'm still admitting people. David was going to do us a little demo. I was going to talk to him a little bit about how long he's been using Surgery Intellect in practice. But Mel, can I ask you to come off mute and perhaps speak on David's behalf and tell us how long he's been using Surgery Intellect, powered by Tortus, in his clinic?
I'll do my best to imitate Dave. No, I'm not. I'm really rubbish at accents. I will not be doing that. Don't spit your tea out, Lucy. Yeah, so Dave went live literally 2 weeks ago. He's probably one of the biggest users of the product at the moment across all of the surgeries. Obviously, he's worked quite closely with the Tortus gang anyway, so he knew the product quite well. And I just will never get over his face on that first demo. I think it was absolutely incredible. He was, if he could jump out of his chair at the particular point in time, I think he would have done, because it was just, you know, the connection to the calls just blew his mind. So I'm really excited to show you that in a minute, hopefully. It all works well for me. I'm not very prepared, so everyone will have to just give me a little bit of a break.
We are all winging it this morning. It's fantastic. It's fantastic. Yeah. Right. So, I mean, on that note, it would be worth just jumping in, I guess, and seeing what we're talking about, if we possibly can, Mel. I know we've thrown you in at the deep end this morning, so this is a big ask.
I am going to do my best. Hopefully, I'm going to show you an EMIS. This works in EMIS or System 1, so either system. We've actually had our first practice go live yesterday with System 1 as a pilot site. So I'm going to attempt to do a fairly decent job. Obviously, I'm not a GP, so please don't judge my clinical discussion. I will probably, you know, wing it a little bit. I haven't got a script ready, but I have been doing a bit of piloting, so hopefully I can take you through a bit of everything. So where should we start? Hopefully everybody on here knows the phone bar and is using the phone bar. Now, the one thing that we have tried to do is embed it in our appointments window. So the appointments window should pull through the sessions. Now, I know, I'm pretty sure I don't have any sessions in here, so you're going to have to see me. This is very much the 11th hour. Now attempt to put an appointment into the appointments book in EMIS, so you can all see how rubbish I am at using the product. Let me go for this.
Is it worth saying, Mel, just because one of the reasons we asked David to do it is because everyone's kind of seen the you know, scribes used in face-to-face interactions. We wanted to do it this way because we absolutely wanted to show what the difference is with Surgery Intellect. And the big difference for us is it can be used on your telephony system. So it's your native telephony system. And this is hopefully going to be one of those live demos that goes entirely swimmingly, doing just that, a consultation on the telephone.
Exactly. So I'm actually going to call Hafsa. She's all ready and fired up. I'm hoping that the audio is all going to work. I haven't done it on a Teams call, so hopefully it's going to capture the audio of both sides of the conversation. Doing a call whilst live is always a bit risky. I should have had a here's one I made earlier, but I don't. So we're going to literally do this on the fly. So I've opened up my appointments window. As you can see, I've just chucked a couple in. That's pretty much instant. The refresh at any time will then allow you to pull through more appointments if they're being added. I'm not going to do a full demo of the whole system, so I'm just going to get into it. So Mr. Fordy Smith, better known as Hafsa, I'm going to make a call. So this is just exactly how you would use your call process anyway. So just single click to call, and I should be calling Hafsa. So hopefully that's ringing. I'm not sure what everyone else can hear. So Hafsa, when you're ready, if you can answer the call, please.
Hello.
Hi, this is your doctor calling about your appointment that you've got today. Can you tell me a little bit about what's wrong?
Hi, yes. So I've had a cough for a few weeks. I also have a fever that's come on in the last few days. And I'm experiencing breathlessness doing kind of really basic activities.
Okay, right. So I'm just going to pause here, not for Hafsa, but more for everybody. As you can notice, the call as it's come up has got a little brain here on the system. So I can now say to Hafsa, I'm using some new technology. This will just be helping me capture my notes. Are you happy for me to use that technology? We are suggesting that some practices do want to introduce it. Others might want to put it on the privacy policy. We've got loads of collateral that goes with it as well, the product, so you can put patient phasing documentation around. So Hafsa, are you okay if I use that technology?
Yeah, I'm ecstatic for you to use it.
Brilliant. That's exactly what we like to hear. I'm glad you didn't ask me any questions about said technology. So I can just click the little brain icon, and then what it will do is it will just switch to start collecting that call information. So sorry, Hafsa, got a bit distracted there. So you said you've got a bit of a temperature. Have you taken your temperature recently?
Yeah, it's 37 degrees. I did it last night.
Okay, all right, that doesn't sound too bad. And you mentioned your heart rate. Do you have you managed to take your pulse or anything in the last couple of days?
No, I haven't done that. But I did have an alert on my Apple Watch saying it dropped really low.
Okay, and did it tell you what low was?
I've lost access to it, unfortunately.
Okay, no problem at all. It sounds like you might have something going on. So what we need to do is just get you in into an actual appointment. So I'll get you booked in. We'll get one of the reception staff to give you a call. Before you hang up, if anything does get any worse, please either contact 111, or if you really have complete tightness in your chest, please call 999. Is there anything else I can help you with today?
No, that's all good. Thank you very much.
Brilliant. Okay, well, thank you for your call, and I'll chat to you soon. So as you can see, whilst that was running, the call was in progress. This will instantly transcribe. If there were any contextual notes that I wanted to add, this is more for face-to-face because you might have some observations, then you can add that in. Then I finish and generate the notes. This will instantly create the clinical notes. The notes will be created in an EMIS note format, so making sure it's taking that problem, history, examination, and comment. You can change this, so you can put it in paragraphs, concise or comprehensive, but we have done a lot of research, and this is the most used format and template, so we've kind of defaulted to this. As you can see, it's captured the temperature here. It's also captured the medical code regarding the temperature as well, and these can all be copied and pasted into the record. The other thing that we have, these templates are fixed. We only have 3 templates. We're not letting any prompt injection into our program. We're fixing everything down to make sure it's, clinically safe, follows the medical standards. And then we do have the letter as well. So letter generation, we have colleague letters, a special referral, and a patient letter. So I just can click and regenerate to generate that letter. That will start doing that. And I can click on there and read that as and how I wish. So I can copy this letter. We're not saving the letter into the clinical system. Because everybody's processes does everything slightly differently. So the letters are sometimes used as tasks. Some people put the text in the task. Some people create documents and send them on, or put them in the document process. So we're going to get some lessons learned from that, and then work out how we can do something with those letters later down the line. Okay, so any of this can be edited at any time or copied from these screens directly. So this is the powered by Tortus bit. The final part of that is the ability to approve and save to Surgery Connect. So we're still working with IM1 at the moment to be able to save that back to the clinical record. That is coming. We just have to go through the approval process. Once that approval process is done, then we will file back to the record. That filing back to the record will be completely the clinician's choice. So if you as a clinician prefer to review everything, you can actually not have that, and you can do all the copy and paste still. So I'm just going to approve and save this to Surgery Connect. That's done. As you can see, it's all locked down, so now I can't change anything. So we know that that's finished. The patient that I was dealing with was 40 Smith. So I just find it funny that I've picked such a random patient name. I can pull back the appointment session at any time, and I can look, so I can see that I've done that call. I can look at the patient contact history, and then I can see that in that patient contact history that I have Mr. Fordy Smith, and he has a Intellect that's been run and saved against that call recording. And that information will hold in our system as long as the call recording is there. So even if you don't copy and paste it directly at that particular time because you've written your own notes, you can go back and pull out any of that information at a later date. So that is the happy path, if you like. But if you forget at any point to press the Intellect button, there is a full mop-up process. So I might have here's one I made earlier. So I'm just going to see if I can open up a different patient record. And this is very much I might have. Otherwise, Hafsa might have to do another call.
Just whilst you're doing that, Mel, I just want to pull out a comment from Darren, which I think is a good one. 2 words: game changer.
Amazing.
I think that's a mic drop. We should just end this now. Walk away.
Yeah, I'm done. I'm not going to show anything else. Yeah, I'm pretty proud of it. So as you can see, here's one I made earlier. I've got George's record open. These have all had intellects because I have actually done a couple of demos before and tried it, luckily. So if I had forgotten to press the add intellect button or the little brain during the call, I can go back to that call at any time and I can click the add intellect button, which will then just open up intellect again and allow us to rerun that call. I think this call doesn't have any data on it, so I'm just gonna see no. So this is just me doing a really quick test call. But again, I could regenerate those notes and improve and save that back to the Surgery Connect record. So there is a complete mop-up process and that's all in place. Now, obviously, everyone uses some people are using scribes already. Scribes are known for their ambient use. So in the room, that is still available with this software. As you might have noticed on the actual appointment session. Now, this refresh that's happening here is actually going to be removed so that's going to not refresh every time you go back and forth because there is a little bit of an overhead in waiting and we don't want to create any friction. So that refresh is going to be removed when it goes live for everybody to use. The other option is, rather than just making a call in exactly the normal way, you can run an ambient. So if you had the patient in the room with you, you can literally press the Open Surgery Intellect icon. This will be connected to the patient. It will pull through the patient information within that ambient scribe. As soon as that loads, it says waiting. Oh, I'm not very patient, sorry. As soon as that loads, it will instantly start listening. So before you press the button, obviously try and have the conversations with the patients just to say I'm running something in the background. Now we've tried this in quite a few settings. I think one of the best ones was at one of our pilot sites. There was a patient that come in for a diabetes checkup and they had to test the wee and they were walking around the room and doing observations and all sorts of stuff. And this was running and it actually did capture everything to the point where the GP actually wrote down the ketones on their hand because they thought, oh, that might not have captured that, but it did. So the mic's pretty good in picking it up directly from people's PCs. So this works in exactly the same. Sorry, Lucy.
I was just going to, because this is a question that's come up in the chat a few times. This is how face-to-face works, isn't it? So essentially the reference you've just made, it was a face-to-face consultation and the clinician was walking around the room and it was still managing to pick things up. And there was no additional equipment necessary, because there was one comment about microphones.
No additional equipment necessarily. The actual mics on the PCs are good enough to be able to pick up. Obviously, if you do need mics, you can plug in any type of mic. It doesn't make sense for us to dictate what you might need. But it hasn't so far in all of the pilots. We're out at 9 sites at the moment. 10th one later this week. So far, nobody's needed a mic to run this process. But, every practice is slightly different. So you can stop and start and resume these as and when. So if you're having your practice interrupted with people coming in and asking questions for any reason, you can stop and start. As soon as you've stopped, you can then generate the transcription. This is not going to have anything interesting because we've just talked about how it works. So I haven't talked about anything medical. I might have mentioned ketones. I don't know if that would have picked that up. So that hasn't picked up anything in there. I think it's because we're just rambling about nothing. So that's just an overview of the ambient process.
But that's quite clever in itself, isn't it? That it hasn't picked anything up because you've not said anything medical. So it is really just about that medical conversation, which is, I think, something that patients would like to understand as well, isn't it?
Yeah, definitely. There's a lot
I'm just
to do.
conscious of time. And
Sorry.
we've also got Patrick on the call, and we've talked a little bit about the pilot sites that we've got in situ at the moment. Patrick, I think you're one of them as well. Could you give us a little bit of perspective from a practice manager's point of view as to the deployment process? How smooth was that? How easy was that?
Yeah, absolutely. I think one of the key bits that we really like in our surgery is how simple it is, and I've not had to give any training to any of the clinicians that are currently using it. You literally just say click on the brain and have a play, and it's that easy. With the microphones, we've used various different ones. Some of the clinicians have laptops and they're perfectly fine. Some of them are using their headsets, but they say they feel a bit silly wearing a headset during a face-to-face consultation, especially if they're doing an examination. Or the ones in the webcams that people have. And ours, they're not, the webcams specifically are quite old. They're sort of 6 or 7 years old, so they're not new bits of tech, but I think they could easily be replaced for £10 or £15. So you don't need to have very high-end microphones for it to work incredibly well. The other parts of sort of the implementation, whilst it's not writing back into EMIS, the clinicians have said that because of all the other bits where it links to the patient and pulls the information and simplicity of linking to the phone call, a simple copy and paste isn't an issue. And we've used Tortus in the past and things like that, and it felt more of an issue when it wasn't linking everything. But now it's linked into the telephony and into the face-to-face consultation, into their appointment book. It all feels very organised and structured, and the clinicians using it are very happy with it so far.
And that's what we all want, isn't it? The happy clinicians. That was on a webinar I saw last week with Dom actually on HTN, where he ended on everybody just needs to be happier, and this is going to bring happiness, which I think was a really nice note to finish on. Don't be alarmed, we're not finished yet. Patrick, sticking with you just for a minute. In terms of preparation for getting this into practice, are there any top tips for those that are on the call and interested?
Well, I think I badgered Mel every 2 weeks for about 6 months so that I could have it first, and I think she gave it. I got it second, so I was okay with that because I was on annual leave. But no, I think the important thing is that we talked about happiness and happy clinicians. It also makes my life as a business manager easier. You can use it for meetings, you can use it for note taking, you can summarize a call recording very quickly if you need to look up what was actually discussed, if a patient's questioning what was discussed in a consultation. So there's sort of various different bits, and I think the key bit for me is not, but this is as a non-clinician, it's not necessarily speeding up the time, it's the quality of note taking. Using these sorts of technologies is incredible, and it has made people happier. So I think you've got to be mindful that obviously things come at a cost, but equally we're all time poor in primary care. We're all looking for a slightly better work-life balance and a better patient experience. So I think it's something that you just need to, whilst you might not be able to see the exact sort of hook or buy-in for everybody straight away, it's not a big leap to just turn it on and start using it. It's not a huge onboarding or implementation process. It's not going to be a headache for months and months and months. It's, yes, I'd like that, please. Can I have it? Turn it on, and off you go. And those that like it will love it and tell everybody else how great it is. So I think it's a very simple option.
Well, that's what we want, very simple and happy people. A few questions have come in on compliance naturally, Hafsa. So I think I'll turn to you, please. Could you confirm, what was the question? What classification of medical device is this?
Yes, so this is a class 1. We being Tortus are going for 2A as well in the coming months. We see at Tortus, we are really passionate about our product being compliant and safe and using AI safely, especially in healthcare. And when the NHSE guidelines came out, we already met and exceeded everything that they recommended. But we also foresee that as AI changes and as legislation changes, that being a class 2A is actually needed for safety. And that's exactly what we're going for. So currently 1A and soon 2A.
Yeah, okay, fantastic. There was also a question around, I've lost it, the different compliance. Actually, whilst I'm trying to find the question I was looking for, Mel, could you just describe or list out, I suppose, the systems that this integrates with, because there were some questions around Vision and System 1. I know you mentioned System 1 at the top of the call, but for those that missed it.
Yeah, so we're not integrating with Vision at the moment. We are integrated with EMIS and System 1, and we've just started working with Medicus. So we have a meeting with them the next couple of weeks to start that integration as well. So the only reason Vision isn't on the list is because obviously they've gone through a bit of a restructure. We're just waiting to get back into the pot and them to sort of balance themselves back out again before we start that process.
And there is a question around the IM1 issue. Do we know roughly how long it will take?
We're in
it's one of those.
The hands of IM1, unfortunately. We have a number in a queue. That number has only gone down by 1 spot in 2 weeks, but they have said that things are moving a little bit quicker. I think there's a bit of a review around AI policies with regards to the integration, which might be once they've kind of been resolved, then we think that it will move a little bit quicker. Oh, my lights have just gone off in the room.
A little flicker. Hafsa, I found it. It was from Vicky. She was asking if there is a DCB 0129 already in place for this.
There is indeed. There's also a DPIA, which covers both Exon Health side and Tortus AI's kind of overarching DPIA. So if you as a practice or ICB wanted to fill that in, we'd send you that template and then you should be able to fill it in. It's quite straightforward. Also, if you already have Exon Health approved, that makes it easier. If you might have been exploring Tortus AI and had that approved, that again makes it easier and quicker, but we can support with documentation as well.
And so that's supporting with documentation that you can then take to your ICB and encourage wider adoption. That's exactly. Awesome. There are plenty of other questions in the chat, which is why I'm struggling to get through them a little bit. Jason asked a good one, though, a bit of a stretch, but can it translate other languages or record and scribe other languages?
So on other languages other than English, the answer is no. And that's because with AI and large language models and speech-to-text models, you measure hallucination rates and omission rates. Now, those are very specific to English. Because AI models are trained in English and other languages. So if we were to do another language, we can't guarantee that same level of accuracy in other languages. So technically it could do it, but we have a really high bar that we want everything to meet, and doing other languages isn't available right now. Could be something in the future. We know there's so much value there, and we want to do it accurately and safely.
Thank you. Yeah, good answer. What's the phrase? As quick as we can.
As slow as we need.
Thank you. And then another good question has come in. Is this just on the phone bar or is it on the WebSoft phone too?
It's only on the phone bar. The integration is fully embedded in the phone bar. However, we are looking at potentially building a remote model so that it will be able to be taken on sites for like home visits or care home visits. So that is on the roadmap. Obviously, we have turned this around quite quickly as a product to launch. So there are quite a few things that will be growing over the coming months.
But is it worth also mentioning that the phone bar is not exclusively Surgery Connect? If you're a non-Surgery Connect user, there is an additional option. So if you're using a different cloud telephony provider, there is an option for you too. Is that good shot yes. Face? Right. Fantastic. There are so many more questions in the chat. I'm not going to get to them all, but we have got the inevitable question around pricing. So Mel, I'm going to turn to you for this one. It all sounds great, but what does it cost?
Yes, I knew it was coming. And at the 11th hour, managed to pin down all the directors to be like, we need to announce what we're going to do. So I have managed to get everybody a free trial for 1 month. All you need to do is just sign up before the end of August and you will get a free trial. No obligations, no contracts, but if you continue post that free trial, we are then doing a reduced early adoption rate of 28p per patient, and that will be on a month by month bill. So it's not a one-off big bill, it's just monthly, and that will be until the 31st of March. we are allowing a 30-day opt-out. So if you are using it and paying for it and you decide you don't want to anymore, you give us 30 days notice in between that early adoption, and that's it really. We're doing this because we want people to have the chance to have a play. We know there's others out there, but that connection to your calls we feel is going to give such a big benefit, especially if you are a Surgery Connect customer. If you're not a Surgery Connect customer and you want to trial the product, I am not sure if that's going to be under the same terms, but please get in contact and we will have that discussion with you separately. I don't know what team to contact.
At this point, the only thing you need to hear is Darren's words, 2 words, game changer. And it's at this point that I invite you to drop your ODS code into the chat if you're interested in talking about this more and you want to find out more. The pricing that Mel's just given you. Remind me again, if you sign up before the 31st of August, it is how much?
It's 28p per patient until the 31st of March 26.
And how easy is it to get out your contract?
1 month's notice.
So it's an absolute no-brainer, guys. ODS codes in the chat if you're interested in talking more. We'd love to hear from you. That's it from us today. We're really delighted that we've been able to show you the product today and you've joined us. Big thanks to all of our guests who came along and the one that didn't make it, him as well. Our next webinar is planned for the 27th of August, so do look out for the link. If you'd like any further information on anything we've discussed or have any pressing issues that we haven't got to today, again, ODS code in the chat and just let me know. A member of the team will reach out to you directly. We will make this recording available in the next couple of days to all registered attendees with all the relevant links, including the webinar from last month that I mentioned earlier. We hope to see you back for more next month. We've got so much more to show you before Christmas. It's going to be a wild ride, so stick with us. In the meantime, on behalf of all of us here at Exon Health, have a happy and healthy July. We'll see you in August for more. Happy summer holidays. It's coming home. It's coming home. Take care. Thanks very much. Bye-bye.
Bye.
Bye, everyone.